Health experts say Indiana is seeing progress in the fight against the opioid epidemic.
They say there's been a 35% decrease in opioid prescriptions from 2013 to 2018. That means less prescriptions for those who have been dependent on opioids for years.
Melissa Crash explains.
Chronic back pain took over this man's life for the past decade.
Several years ago, I was involved in a plane accident.
He wants to keep his identity private. After the accident, his doctor prescribed a common opioid that could help.
It was like a miracle cure, and it was called OxyContin.
A miracle that turned into a nightmare. After a while, his doctor had to keep upping the dosage until 2 months ago, his doctor pulled back.
I was in panic mode.
Scaling the dosage down by 25% until he's off the drug for good.
Because now I'm either going to have to go to the streets or I'm going to have to go to the pain management clinic, and I chose the latter.
Doctors across Indiana are cracking down on highly addictive painkillers and suggesting alternative options, like over-the-counter medications and non-drug treatments.
They're making us responsible for the welfare of that patient after they leave the office.
Dr. Amy Crambeck at IU Health practices narcotic-free surgery. She says the CDC developed guidelines for prescribing opioids for doctors to keep an eye on dosages and follow-ups. Although difficult to adopt, Dr. Crambeck says it's necessary.
We thought our goal was to lower pain as low as possible, and to do that we needed to prescribe narcotics. We're realizing that we need to maybe rethink how we prescribe narcotics.
Brian Tabor with Indiana Hospital Association says Indiana is moving in the right direction.
We've seen a decrease of 35% in the number of opioid prescriptions over the last 5 years.
Tabor credits policymakers in the prescription drug monitoring system called Inspect.
The state has helped providers connect to that system to look at a patient's history to be able to identify risks of addiction.
Addicted for years, a life without OxyContin seemed out of reach.
But at first I didn't understand that.
Until his doctor changed his way of life.
I have every intention of beating it and getting to where I don't need any pain meds at all.
I'm Melissa Crash, CBS 4 News.